So how our diseases correlate to the top 20 in class is the VQ, or the perfusion ratio, is going to be greater than 1 in a pulmonary embolism, because that ventilation is going to be much higher than that cardiac output due to the blood clot. We also talked about how the respiratory disorders can be classified as obstructive, restrictive, a perfusion disorder, or a ventilation. And so with a pulmonary embolism, it is a perfusion issue because not enough blood is getting to the base of the lungs.
And then for a DVT and thrombophlebitis, you're going to have an increased left ventricular contraction because your heart has to work harder to get blood through the system because of that clot, which is going to result in increased blood pressure. Going along those lines, you're going to have hypertension, and hypertension is common with people who are sedentary and obese, which kind of correlates there, because when you're sedentary and obese, you're going to get a blood clot. If you get a blood clot, you're going to have the increased left ventricular contraction and the increased blood pressure. And then cardiac and respiratory function, both of those are going to be, well, respiratory function is going to be decreased, and then your cardiac function, it's going to be working harder, so it's going to be an increased cardiac function. And that is how they relate to the top 20.